The DEA says fentanyl is the deadliest drug our country has ever faced. In tonight's Wear the Gown, KENS 5 reporter Jeremy Baker looks into prescribed fentanyl and what any patient taking it needs to know.
Fentanyl is like an overcharged morphine, but it's synthetic and made in a lab and 50 to 100 times more potent than morphine, which is one of the reasons why it could be so dangerous if not used properly.
Fentanyl is actually FDA approved for really is for chronic pain that if you've previously been on morphine or something similar to that, just really isn't cutting it.
Dwayne Davidson is a clinical pharmacy practice manager with University Health. He says if a patient is using morphine but has a pain spike, fentanyl is often prescribed in varying formulations.
Some that work really quickly, like lollipops and lozenges you kind of suck on like candy. We also have patches that you wear for 2 to 3 days, even to kind of provide some of that background pain.
Fentanyl is often prescribed for cancer patients in palliative care, those who are allergic to morphine, patients who take medication several times a day, people who recently had surgery and need to control their pain, and for patients on weaker pain medication that is no longer working. And there is a system in place to not just protect the patient from having too much medication, but also to protect the public.
Even before prescribing it, the physicians are supposed to check our Texas State website, see if that patient has other opioids that maybe a different prescriber had given them, so that way we don't give a patient too much.
The pharmacy has to check too. And if you are prescribed fentanyl and have some concerns, talk to your doctor about alternatives.
There's some other options out there that may work that we typically don't use in terms of pain control. Just ask the doctor, hey, is this right for me, before they actually prescribe it.
For more information about fentanyl from Davidson, check out this story on KENS5.com. Jeremy Baker, KENS 5.
And if you would like to see more of our Wear the Gown stories, just head to wearthegown.com. I don't know